you had this great line. I think when we were previously talking, you sort of mentioned, that, we can't accept that this is how it is in healthcare. And, you said, ask optometrists how they feel about Warby Parker, ask pharmacies how they feel about PillPack or orthodontists with Smile Direct. So for your role as the CEO, how are you sort of setting that vision and strategy for UC Davis to sort of be, I guess, maybe Warby Parker versus the optometrist? I'm not really sure in that analogy which one you want to necessarily be, but, certainly to sort of, I guess, really, but to not fall behind, right? Because I think there are so many changes that are happening and it's so easy to either do nothing, right? And just be okay with the status quo. But I'm curious for you, how you are setting that sort of vision and strategy for UC Davis to really kind of lead it and be out ahead of the pack when it comes to, the experience that you are offering your patients.
Right. Well, that's a great question because it is really easy to just have the status quo. I mean, doctors, especially, we're like people to move our cheese, right? We like things the way they are. We've spent an amazing amount of time getting educating and training ourselves to work within the system the way that it is. And, change is uncomfortable. Luckily, I happen to be a change management person. So still for me, I'm a real Cotter devotee. And I really believe that change is not only necessary, it's essential. And it's especially essential now. The pace of change in the technology and information delivery world has just exploded and we're not quite keeping pace. So to that end, I hired another chief that didn't exist before. I hired a chief digital health officer and I changed the name. Well, I should say he changed the name of our information technology office, innovation technology, because it's not just about the computers and running the electronic medical record. Those are very clearly part of the infrastructure that we have to do. But it really is about innovating around bringing the latest applications and knowledge to the benefit of our patients. And so we now have an app formulary, which we're beginning to roll out on behalf of our patients, where we evaluate all the software that's out there for chronic disease management or whatever. And we say, hey, we think this is the best one. We're going to prescribe it. So we hired the organization, actually UC's first chief digital health officer, his job is to rethink the digital experience and its interdigitation, if you will, with the bricks and mortar world that we're living in. So we're not only building a brand new hospital called California Tower, it's $3.5 billion. We're actually putting money into our virtual hospital so that there is truly a continuum, that your care doesn't end when you leave our four walls, that we really are watching after you and your lab values and your physiologic variables after you leave our hospital, after you leave our clinics. And doing it in a way that's not separate from the health system. I think that this is sort of the holy grail, if you will, of how we take better care of patients and the patient experience is we only do inside of bricks and mortar that which needs to be done inside of a brick and mortar workplace.